Hello, everyone, and welcome to another episode of Healthy Politics, where we're discussing the eternal intersection of healthcare in the United States and American politics. My name is Nick Carls. I'm the compliance director in the Employee Benefits Department here at Holmes Murphy, benefits attorney. And with me is my esteemed co-host, Den Bishop, former president of Holmes Murphy and our longtime healthcare strategist extraordinaire. Den, say hello.
Hi, Nick. How are you? Looking forward to this session. Lots to talk about.
Yeah, lots and lots to talk about. Looking forward to it too. Unfortunately for our marketing friends, they had to listen to us geek out about it for a little bit before we even started recording. That's kind of what we do though, right? We start talking and we don't stop. And I do also want to say I appreciate everyone that reached out to let me know that my audio was better after our first recording. I don't know if anyone's seen Office Space, but it reminded me a lot about being reminded about your TPS reports. Hey, great recording. Did you know you had an issue with your audio? Yes, we did know. We got the microphone. We're good now. Neither here nor there. So I think, two things that we were kind of talking about, or three things, but one of the biggest ones is Kamala Harris selected Tim Walz as her running mate. I'm here in Minnesota, so that's our governor. And it was kind of an interesting twist, right? I don't know that a lot of us saw that coming. My older brother did have to point out that he called that weeks ago. It was pretty impressive, actually. But for a lot of us, we didn't see it coming. But, he kind of catapulted himself into the national spotlight. And so I think it's worth it. And Den, I think you agree that we spend a little bit of time about, talking about what's going on in Minnesota and where Tim Walz stands.
Absolutely. In our last episode, we talked about J.D. Vance joining the Trump ticket and how that kind of moved the ticket a little bit to the center based on J.D. Vance and kind of he was not, he's more of a, hey, let's just make what's working work and add a little bit. I think Tim Walz, in my opinion, potentially pulls the Democratic Party a little bit away from center in a few ways, especially from where Joe Biden is. Maybe not where candidate and Vice President Harris is, but I think there's some very interesting things that happen and are happening in Minnesota that are worth talking about, just so people understand kind of as governor what was happening around healthcare in Minnesota.
Yeah, and there's an evolution with Tim Walz that we have to get into. When he was in Congress, he was a congressman from a southern district here in Minnesota that was generally a red district, right? He voted for the Affordable Care Act, and healthcare down in the kind of Mankato, southern Minnesota area had been pretty good. Right? Decent prices, decent access. Obviously there's pre-existing condition exclusions, out-of-pocket issues, all of that stuff. But you started to see after the Affordable Care Act go into play, prices started going way up in that part of Minnesota, right? And so Tim Walz did come out when he was in Congress and say, I'm willing to work on changing this. If this isn't working, I'm happy to entertain some ideas, whatever. So at that time, it's kind of interesting. It was like he was willing to work with the Republicans, whoever, to try to find a better solution because it was having a pretty significant impact on his constituents, right? But that was then, and this is now, right? And things have changed. I think one of the, we had a budget surplus up here in Minnesota couple year back. It was a fairly substantial one. And they used some of that surplus to continue to enhance the subsidies that people could use to purchase coverage through the exchange, right? Through the ACA marketplace. One of the only states that I know of that did that, right? Where you are using state money to bump up enrollment in the federal program. So that, to me right there, I mean, that's a pretty big statement. Den, I'll let you cut in a second here, but the other one, not yet though. The other one that I think is interesting is we have laws going into place where you can't, hospitals or providers can't transfer medical debt. That's a new law that went into play where you can't transfer medical debt. You can't go after widowers for the medical debt for their deceased spouse. So there are all sorts of things that are going in right now where they're trying to kind of limit the impact of any kind of medical debt that people might take on. Someone's going to pay that. As you were taught, I've talked about with prescription drug coverage, all of that. If the hospitals can't collect on that debt from the individual, they're going to have to go to the state and request support to stay open. And so I'm sure that you're going to see funding bills in Minnesota with more money going to hospitals to keep them open, as we probably see greater defaults on that medical debt because it's harder for them to collect on it.
But an issue like medical debt from a voter standpoint, I think is going to be very popular.
Absolutely.
And so I do think some of these items and kind of the favor the patient, favor the consumer, not favor the healthcare entity or the insurance company is kind of where I view he has been on his policies, which I find fascinating in the state of Minnesota because you have the largest healthcare insurance and provider employer of physicians. United Health Group is headquartered there, and you also have the most well-known and probably most respected brand in hospitals, Mayo,
Yep.
also headquartered there. As I understand it, there's a lawsuit right now between United Health Group and the state of Minnesota on whether for-profit entities can be in the state plans.
Yep.
So,
The state plans, the Medicaid plans, and all of
yes.
that. And we could probably do an entire presentation on that one, right? It is interesting because it's easier for the state of Minnesota to push back on a United Healthcare, right? There was some legislation that we were looking at doing regarding medical debt and different things regarding what hospitals could charge, and the Mayo Clinic did not like it and was very vocal about their displeasure at it, right? And you watch the state back off, right? So it kind of goes back to what you're talking about, though, right? I think when we're looking at policy and we're looking at a lot of politicians, it's less going after the providers, less going, trying to enhance the way that the consumers can access the care, whatever. I think everyone's fine going after the Uniteds right now. You know what I mean? It's that they are the easy target at this time. It's a for-profit. It's one of the most profitable companies in the U.S. And so I do think that that's going to be a growing trend. And I think that does tie into some of the politics that we're seeing nationally, right? How much of Tim Walz's kind of historical, Minnesota-centric policies make it into the campaign? We'll have to see. Right.
Yeah, it's very interesting this campaign cycle versus prior cycles, and what the polls seem to be indicating people are responding to or not responding. And this cycle seems to be much more focused on aspirational statements.
Yes.
And any concrete solutions. So what are we for? We're for lower drug prices. Without really speaking to other than Medicare, well, how would we do that? We're for better access to healthcare. We're for lower cost. It's these aspirational statements related to health insurance that are actually seem to be resonating without any demand for, well, how are we going to do that? Prior cycles, it was, well, it's Medicare for all, or Medicare for all who want it, or it's repeal and replace. It was very tactical in prior election cycles. And this time around, it's really saying, I'm for blue sky. And you go, good. I love blue sky too. And so it's interesting to see how potential voters are responding to what's being said on both sides. On the Republican side, if we recall back to the Republican convention a few weeks ago, on healthcare, there was really no discussion at all. It was largely silent and just avoiding the issue. On the Democratic side, with the convention coming up next week, I think we'll hear a lot of this aspirational talk about we want lower cost, we want better access, we want these kinds of things, without maybe really giving us much of, well, here's how we might do it from a policy standpoint.
100%. 100%. And part of it might be something that we talked about in a past episode where a lot of people just don't understand how health insurance, healthcare works, right? But I think that's a great segue. So I spent a little bit of time going through the different Senate races, trying to figure out, okay, what are they saying, whatever. And I won't bore everyone by going through every single one, but there were a couple of interesting ones. You look out in places like Montana, where the incumbent's a Democrat, looks like it's gonna be a really, really close race. John Tester is silent on healthcare on his website. You don't see anything in there. His opponent, Tim Sheehy, I think I'm saying that right. Sheehy. There's someone from Montana here, and I'm saying it wrong. Let me know. It's kind of a funky thing where talks about the issues that have come with Obamacare, as he terms it, but then says that he supports things like transparency and no pre-acts, and those are things from the Affordable Care Act, right? So we have this kind of and I think that's kind of where a lot of Americans' understanding of healthcare is, right? Yes, we have issues with cost, but I like these other things. But going back to what you were talking about, I've noticed, when I looked at the Wisconsin race between Tammy Baldwin and Eric Hoved, and I think again, I'm saying that last name right, or hope I am. What I think is super interesting about Tammy Baldwin's position is she started using terminology that I've also heard other people wanting Kamala Harris to use more, and that is universal coverage. Right? They're not saying universal health care. They're not saying Medicare for all. They're saying universal coverage. And that leaves the door open to pull a bunch of different levers, whether it's expanding Medicare down to age 50, where you can do a buy-in, right? Expanding Medicaid, so that way more people can qualify for it. You'd have to fund that, obviously, right? Greater subsidies for premiums to purchase plans through the exchanges. You can do all these things to try to accomplish universal coverage. And when you look at some of the other races, you see people kind of talking about expanding that access. Another one is in Texas, right? We have Ted Cruz, we have Colin Allred, and Ted's campaign website is silent, but he's still on his senatorial website talks about getting rid of the Affordable Care Act. He does have a couple policy positions like expanding the HSAs, purchasing insurance across state lines, some things like that. You're like, okay, this is interesting. Colin Allred again talks about enhancing the programs that are in place. He wants Texas to join in with the other states and start doing the Medicaid expansion under the Affordable Care Act. He talks about protecting the Affordable Care Act and expanding it. So we're talking about, Medicaid, Affordable Care Act talks about protecting Medicare. So we see again this kind of idea of using multiple programs that already exist to start to kind of move that line towards universal, let's call it, coverage.
And I really think on this issue of we want better access to healthcare, we want affordable healthcare, we want universal, we want everyone to have coverage. Again, those are aspirational statements that you cannot deny would be good. And so it ultimately then I think comes down to, okay, so let's say that this goes, if we wanted to see something that actually happens,
right.
what might actually, if all of this came to be and you had, alignment around trying to get things done, what do those ideas look like? I don't think we will see Medicare for all recycle anytime soon.
No,
I think it's too progressive for people, but I felt like the last cycle around Mayor Pete's campaign slogan on healthcare, I thought was the best of anybody in terms of appeal. I'm not going to say whether it's the right idea or wrong idea, but from an appeal standpoint, it was Medicare for all who want it, which was brilliant. Hey, if you like what you have, keep it. If not, here's Medicare. We can expand access to this, get more affordable, and those kinds of ideas and talking points, I think, are going to be very popular. It all goes down to in the end, how do we deal with the underlying cost of the healthcare services?
Right.
It's not the cost of insurance that's the problem. It's the cost of delivering care, because the Affordable Care Act capped how much profit an insurance company can make. And that really hasn't done a lot in terms of that, because the cost of care. So we have now a situation where for a small number of initial drugs just getting rolled out right now, but been coming for a couple of years, that the federal government negotiating drug prices for the first time in the history of our company. Are we going to see them try to expand that and make it maybe where that's for everybody, kind of a war against the drug manufacturers potentially? Do we see PBM, pharmacy benefit management reform, where they maybe try to go kind of get at those stakeholders? And maybe in Minnesota right now, one of the discussions is a public option that would reimburse providers at Medicare rates. Our clients nationwide are paying 250 to 300% of Medicare for their services. If they could access something that could pay at Medicare, it would effectively cut the cost of insurance in half if all you did was that. So whether we're ever going to get to these things coming realistic or not, those are the kinds of ideas that would have to get brought forward to deliver the access and the lower cost that's being discussed.
Yeah. And there are also older ideas that haven't come up at all. Do you remember when everyone used to talk about tort reform, using tort reform to help lower medical costs? And for those of you who don't know what I'm talking about, it's basically changing the way that providers can be sued for malpractice and other things like that. That's part of tort reform. There's other, avenues to it, but that's one of the ways they talked about reducing health costs was, hey, these providers in outstate Minnesota, let's say, are closing their doors because the liability that they have if someone comes in, for to have a child or something like that is too great. Now, we also would say that that's probably not the only thing that's causing them to close, but it was a good thing, right? Or a good thing. The plaintiff's attorney lobby is a pretty strong one. If you look at a lot of those folks that sit in Congress, turns out a lot of them are attorneys. So there's that one's usually gone, but those types of ideas, I'd be curious to see if that starts to kind of come back around at some point as we again start talking more about the provision of healthcare, about the provider side of things, and less about the health insurance.
Yeah, if you look at lobby spending for a long, long time, a couple of decades, there was it outspent everyone. It was tobacco. And eventually, there were big lawsuits in it, and tobacco kind of took they are no longer, they have been replaced in DC. And this was about 15 years ago that this occurred. The number one spending industry in Washington, DC is healthcare in
Yeah.
terms of lobbying efforts. So as we move potentially from aspirational statements to more concrete ideas, those that might be on the losing end of that are going to try to wield their political influence in DC to try to keep these things from happening. This cycle goes on, gives us plenty to talk about.
100%. Well, I think we're kind of coming up on the end here. Den, I did want to ask you about some of your impressions on what's going on in Texas. I think we might have to do that next time because we'll talk about the Democratic convention, and then maybe spend a little bit of time talking about what's going on in Texas. Maybe talk a little bit more about Ted and Colin and what's going on there. But with that, I think we will call it a day. We do really appreciate everyone joining us for another episode of Healthy Politics. This doesn't have to be the end of the conversation, as I always say. If you have questions, comments, there's something you want to discuss further, reach out to your Holmes Murphy representative. They know how to get in touch with us, and more than happy to continue that conversation. But thank you again for joining.
Thanks, Nick.
Thank you, Den.